this session, this webinar is in collaboration, a PMA webinar is in collaboration of Women Medical College, South Asian Association of Physiology, Pakistan Physiology Society, and Pakistan Association of Pathologists, and Medical Women Association of Pakistan. So today we have very respected colleague and very respected speaker. Professor Salma is there. Oh, Professor Salma, how are you? Okay, she is muted. Professor Rashid Saab,
Yes,
before starting today's session, I will request to you for the recitation of Holy Quran, because with the holy name of the Almighty Allah, we always start our webinar. Over to you.
right. Am I audible?
Yes.
Right. Thank you. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. I seek refuge in Allah from devil, the ill-fated. In the name of Allah, the most gracious, the most merciful. I have taken two verses from Holy Quran, and I shall recite along with the translation. قل للمؤمنين يغضوا من أبصارهم ويحفظوا فروجهم ذلك أزكى لهم إن الله خبير بما يصنعون. Tell the believing men that they must lower their gazes and guard their private parts. It is more decent for them. Surely Allah is all aware of what they do. وقل للمؤمنين يغضضن من أبصارهن ويخفضن فروجهن ولا يبدين زينتهن إلا ما ظهر منها وليضربن بخمرهن على جيوبهن ولا يبدين زينتهن إلا لبعولتهن أو آبائهن أو آباء بعولتهن. And tell the believing women that they must lower their stares and guard their private parts, and must not expose their beautification except that which appears thereof, and must wrap their breasts with their shawls, and must not expose their decoration except to their husbands. Sadaqallahul Azim.
Jazakallah. Thank you so much. Very important verses of the Holy Quran from Allah. I will request Dr. Professor Nizami Saab to welcome Professor Angelique.
Thank you very much, Professor Bukhari Sahab. It is indeed a great honor to have Professor Angelique on the webinar. Indeed, we in Pakistan, we have a lot of respect, regard, and if I say simple, that we love her. And she is very kind to Pakistan. She is very kind to the humanity, and her human being the humanist, her actions for the medical profession and for the community, for humanity at large, global,
Yes.
I would like to appreciate and extend my gratitude and thanks to her that she is now offering us a lecture and informing about the medical developments. Thank you very much. Welcome, Angelique, and thank you, Mulazim Hussain Bukhari sir.
Thank you, sir. Thank you so much, Professor Ashraf Nizami Saab, because you are the president of PMA Lahore, and thank you, Professor Arif Zaidi Saab, Professor Arif Zaidi Saab from Bawalpur, from Zamir Mushtaq Saab, from Dania Khan, and any all others. You are here because today's very our teacher of the teachers, Professor Majid Chaudhary, is there, sir. Thank you so much, sir, for joining, sir, and. Professor Angelique, I think Professor Majid Chaudhary met you in the Aptabad. Thank you so much.
Yes.
Over to you. I will not waste the time. Over to you, Professor Angelique, for today's presentation.
Good morning, and let me try to share. Just please be kind towards me. There we go. Just one more. Need to share there. Okay. Need to go one slide back. Just want to get it into Power where I can share with everyone. There we go. You can all see my screen. You can
Yes,
see my
you are
screen.
audible
Yes,
and
all
your
is good.
screen is visible.
Yeah, all is good.
Thank you. Thank you. I'm not so much going to talk about new inventions in the female field. I would actually like to do a more thought-provoking presentation on what female doctors experience at work and why it matters to patients, the institutions, and our healthcare system. Before I start, I also wish Salma a speedy recovery. And yes, Pakistan is very dear and close to my heart. I don't know why. I think we share the same problems, and it makes us put us in the same boat. So if we look at, just need to get this away. I'm not sure how to get the pictures away here. Right, okay. There we go. So if we look at medicine, what does medicine lose when women are present in the workforce? But they're actually absent from the rooms where we see the money, the power, and all of that are decided. So when women are entering medicine in large numbers, we are still reward a sort of a 20th century model of the what is the ideal doctor. And the answer is lying in what you can measure. You can measure your leadership gaps, your pay gaps, your safety risks, your burnout, your attrition, and the attrition that you have towards the system. So we need to have three discussions. We need to shift from fixing women to fixing systems that select, promote, and protect people unevenly. And then we need to shift from work-life balance to workforce design, your care and your professional sustainability. And then also from women's issue to patient safety, your quality, your resilience, and your governance. Also, I don't want to be, as a female, be in giving a position in leadership or a higher position just to fill the number of being a female. I want to fill that position because I am capable. There's merits in me having that position. I don't want to be a number, a tick box number. So here's the paradox. So delivered by women, services delivered by women, often led by men. So we know medicine is changing numerically much faster than its power structures are changing culturally. We know that. It's a given fact. So by implication, if people carrying the work do not shape the rules of the workplace, then your inequity is not incidental. It actually becomes an operational design. And we need to look at that. We need to make sure that our operational design is where it's supposed to be. It must be designed correctly. So coming back to my point that feminization of your workforce does not automatically dismantle your masculine defaults in your training, your leadership, your private practice economy, or your family unfriendly schedule. And, while doing this, I also thought we talk about family and friendly scheduling in the context of females, but also, there are we need to balance it with the men as well, because men also might find family and friendly scheduling. So we really need to look at the larger picture and try to come more into touch with what is happening in the 21st century and move away from the 20th century. We need to do that. We need to look different at what we are doing. If we keep on doing the same thing with the same outdated models, then we cannot expect new answers. We cannot expect to change for the betterment. And here again, it's not only for females, it's also for our male colleagues as well. So here we can see how the pipeline is widening, how the power pipeline still narrowing, shaping. If you look at these definitions. So what does the evidence say to us? Where is the data the strongest? And where is the silence? Where can we see this? So the strongest evidence base is in the academic medicine, in your training, your surgery, your pay, your harassment, your burnout, and your leadership. And that's mostly from your high income settings. Then we have these consistent patterns that we can see, the gendered expectations. Then we have the weakest evidence base is lying in your private practice dynamics, in your rural medicine, in your informal power structures, in your non-English speaking countries, and many low middle income contexts. So there we have the weakest evidence base. What is the practical conclusion? We do not wait for perfect local data before we start to act. We need to build the local measurements while implementing known protections. This is move away from what we know and be bold enough to start to change the medical field fraternity, making it more friendly for a better word, for not only our female doctors, but also for our male colleagues. So our workplace challenge is really multi-layered. We look at where female doctors not only facing one barrier, we are managing stacked frictions. We look at the status. Sometimes we are being underestimated. We are interrupted. We are mistaken or treated as less authoritative. We look at the safety, where there still is harassment, the violence, the unsafe solo work, night shifts. So, the vulnerability of females in night shifts, especially in hospitals which are in communities that we know are high crime type of or violence communities. The time, so the money and the voice, we are sometimes exclude from decisions, from committees, conferences, our academic authority and senior leadership. I have sat in meetings where, for females, I know, we sometimes are a bit more emotional like men, and we tend to raise our voices sometimes, not all that nicely mannered than men, and the same type of voice. And the moment we start to sort of raise our voice as part of how we normally would address a problem, we are then saying, oh, you are emotional, or you are, it's hormonal or whatever. Never saying, looking at what we're trying to say. So we need to think different. So a pay gap is rarely just pay. It can reflect on the referrals, the procedures, the maternity timing. All of that is extremely important, and part of the workplace challenges. As I said, it's multi-layered. So if you look at the status tax, sometimes women need to prove their competence again and again and again. So you will see, you come into a ward, or you walk into where patients are sitting, and you start to engage with the patient, and then you will get the thing, are you the nurse? Or you are good for a woman doctor? So what does that mean? Or can we wait for the consultant? Or you're too young to be in charge? So it is a perception, but when you stand there and someone, and you're very tired, you've worked a long shift, and then someone says, you are too young to be here. You cannot be in charge. That is not okay. Would they ever say that to a male colleague? I'm not always sure. So these comments are very irritating. All right. And we need to change that. So how much cognitive bandwidth is lost when excellent doctors are repeatedly forced to negotiate your basic professional recognition. Because now you first need to make sure that the patient understands that, you're not maybe a pretty face, or you're not too young, or not too old. You have to overcome those barriers, which can be sometimes disheartening for a female doctor. When you look at your safety issues, safety design really matters. Panic systems, chaperone policies, protective reporting, the consequences, safer night work, and leadership response. It should all be there. We all need to look at the safety. And again, in the changing landscape that we are currently working in, I would also say what is good for the female doctors should be good for the male doctors as well. Because safety nowadays is not only linked to females, but we need to bring and to take that environment into consideration when you give posts, or when you want to work. Let a female doctor work in very safe conditions. Again, it's not always safer for men, but again, if we can get this right, then maybe for the male it would also be beneficial. So if we look at motherhood and caregiving penalties, we know that female doctors, we are doctors, we know that the female reproductive life is too often treated as a scheduling inconvenience rather than a predictable workforce reality. So 35% of physician mothers in a large survey reported maternal discrimination. 89% of maternal discrimination reports involve pregnancy or maternity leave. And then you've got around about 48% involve breastfeeding related discrimination. So if we look at your workforce design, most doctors will pass through predictable life phases. We go through pregnancy, parenthood, elder care, illnesses. Why do we still design careers around the fantasy of the permanently unencumbered worker? And now with men also in some countries having maternity leave, has it even been taken into consideration for our male colleagues? I'm not just here for saying the females, we need everything for the females, because in the end of the day, whatever we get right on the female side, we can also get right in the male side. So for me, it is important. We need to look at all of this. The pay gap, it is not only a salary problem. It is a consequence of power over time, referrals, procedures, leadership, hours, and unpaid work. How many of us sitting here today, male and female, are getting or are doing unpaid work? Yes, we do it because we love our job, we love our profession. But sometimes there should be also, it should be ring-fenced to help us going forward. If you look at this is from the physicians. This is a US study that you look at the salary there. So your male physicians earned around about 24 to 32, 23% more per hour in the study. And family structure widened the total earning gaps. We should not have that. We need to audit this. We need to look at this. We need to make this gap much narrower going forward. And then burnout. Burnout is not a failure of resilience. I can promise you, we all know that. It is often the predictable endpoint of unsafe cultures, chronic overload, discrimination, moral injury, and inflexible work design. So we need to shift from how do we make women tougher to which part of our workplace are producing harm. And we need to look at that. And again, with the younger generation, we've seen that as older generation, we are resilient. We have been through the mill, we know. But the young generation's got a different view of the world. They're not thinking the same than we do. And we need to prepare our medical environment to take their beliefs also into account and their needs, and not say, I've worked this hard when I was your age, therefore you will need to do the same. We need to look at the workplace and see how we can shift that. I want to say this, the glass ceiling is rarely one piece of glass. It is a stack of small filters, informal sponsorship, visible assignments, publication credit, call rosters, all of that. So leadership equity is not achieved by inviting women to speak after decisions already made. They should not make women a rubber stamping or a rubber stample of that glass ceiling and that decisions that has been taken. I always say in the dark rooms, we need to be open, we need to be transparent, and we need to give credit where it should be. We cannot keep on doing the same thing and expecting different results. So if you look at your speciality and your career path segregation, in lots of countries it still persists. The old question always was, can women do the work? The current question should be, who get access to the work that builds power? So we need to look at that. We need to have a practical audit. Are women offered the same career-making cases, lists, mentorships, and decision-making exposure? We need to take stock of that. We need to look at that. We cannot just say, can you do the work? If I apply for the work, it means I'm confident that I can do the work. And then I would like to get the work based on merits, that indeed I do possess the right qualifications and skills to do this. So intersectionality, not all women doctors experience the same workplace. So we can see if you look at the women doctor, there's race and ethnicity, there's migration, there's religion, there's dresses, there's age, there's disability. You name it, it's there. So equity is weakened when we treat women doctors as a single uniform group. Sorry for my dog. Why? Why does this matter to patients and to the system? So health systems cannot afford to underuse doctors whose work may improve access, communication, trust, continuity, safety, and outcomes. There was this Canadian cohort of surgical patients, and the observational evidence in that was there's not proof that women are naturally better. It signals that practice, style, communication, selection, teamwork, and system design deserve serious attention. We need to look at that. The evidence is there. We need to make sure that we change. Then the hidden tax, the invisible labor that rarely appears on a CV. Again, here, it also applied to our male colleagues. But for female, more emotional labor. You need to calm the families. You need to train and look at your teams, your diversity, your administrative glue, your teaching and your nurturing, your domestic care spillover. So the governance test here is, does your promotion system reward the labor that sustains quality, or only the labor that is easiest to count? What are we doing? What are we measuring? Do we measure the right things? And then what does not work? The resilience-only programs, mentorship without sponsorship, one exceptional woman model. It celebrates survival while leaving the barriers still intact. We haven't done anything. And women-only committees, but there's no budget. So we like to say, this is a women committee. But then we struggle with budget. I'm quite sure that Salma, even in her university, also faces a lot of barriers We need to fix that. So the test of sincerity is budget, authority, metrics, and consequences. I cannot stress it enough. We make the same mistakes over and over again, and then we cannot understand why no one is happy in the workplace and the workforce. So do not ask individual women to negotiate every protection as a personal favor. Build the protection into your policy, your budget, and your routine. Equity becomes real when it is boring, documented, and enforceable. We need to look at that. So there's 7 institutional levers, and we need to look at that. We need to make sure that our design principle addresses what needs to be addressed. So if you look at the governance dashboard for gender equity in medical workplaces, again, you've got your metric. You have to ask, why does it matter? What is the minimum question that you need to ask? You need to look around, again, pay and incentives, promotion, your case or allocations, your safety, your pregnant care support. I mean, you know that the majority of women would like to become a mother. You know that the moment that when you employ that young, fresh, out of the college or university female doctor, that there's a possibility that along the line, she might want a family. So you need to bring that into your design and say, how can we address this going forward without making her feel that she cannot have a baby or a family? And I don't think it's right. We need to look at that. And if you can look at this, your levels, the solution must be multi-level. Individual courage is not enough without institutional responsibility. And I'm sure some of my female colleagues here know that they had, I'm quite sure, individual courage to stand up and to say, this needs to change. But was there any institutional responsibility to really listen to them, to make that change? So your culture only changes when the cost of harm shifts from the person who reports it to the system that allowed it. And we need to take a deep look in, are our systems currently allowing this? This what we are seeing, especially around female workforce going forward. In 1 year, my challenge would be, in 1 year, what would prove that your institution do more than just applaud women doctors? Is there one number, one policy, one power shift? Again, equity is not achieved by admiration. It is achieved by redesigning the workplace so excellence is not punished by gender. We need to look at that. We need to change. We need to make sure that whatever we do it that not only for our female doctors, but also to better our system. I know it's not a long talk. It is Mother's Day, so I try to be cognizant of that. So again, we are females, and we need to be there. We need to be there for our families. We need to be there for whoever is out there that needs us. So females are also caring, and we are nurturing. So I've seen there's some chats. I haven't looked at the chats, but you're welcome
Okay,
to
Professor Angelique,
ask.
before you conclude, thank you. Professor Angelique, before you conclude today's very important topic, can you 1 or 2 minutes give the summary, what the message you want to convey from today's session?
I think what we need to do, we need to look again at our systems, the current systems that we are having. Is it made for, are we still using the 20th century guidelines? manual, or have we moved forward into a 21st century? How important are our female doctors to the health of our nations? Do we allow our female doctors the meritocracy that they deserve to be able to fill positions? And are we look at the safety? Do we take into consideration that females, as I've said, out of our nature, we are nurturing people. We a bit different from our male counterparts. And we accept that our males have a certain way of doing things, but please accept that females also have a different approach. We've got a total different approach when it comes to care to patients. And most of us might get emotional with our patients because we understand maybe a bit more. While many is different, we have to open our workplaces for female doctors, but also taking into consideration that the new generation is not the same than our older generation. So we need to change our systems. We need to bring the female doctors on equity and meritocracy back into the system.
Thank you. Dr. Salma Rafiq, you are a gynecologist and you have a lot of experience, a lot of webinar. Can you comment on this before I allow for the answer question? Professor Salma Rafiq or Professor Salma Batul, any of
Assalamu alaikum, sir. Assalamu
Thank
alaikum.
you.
I
Thank you so
could
much.
just join it because I have some of the internet issue.
Okay.
So we can have question answer session, then I will comment.
Okay, Professor Salma Batul, you were present since the start of this topic. Can you comment, Professor Salma Batul from Women Medical Association?
Thank you, sir. Thank you for giving me this opportunity. I also attended in the mid of the session, but whatever I have attended, and in the perspective of Mother's Day, especially being a pediatrician, there need to be a lot of work done in our setup because we don't have any antenatal counseling of mothers regarding their motherhood. We have to establish that particular area as well in collaboration definitely with the obstetricians and management, and it should be part of our curricula by PMDC, by UHS and other. And also I think that afterwards, regarding the help of mothers, especially the new mothers, in bonding and in taking care of their newborns, there is a responsibility not only of a particular institution or a particular government setup. It is a responsibility of community as such. So we need to have more awareness campaigns regarding the rights of a new mother or a mother who has become has achieved this status of motherhood, maybe for the first time or any time, whatever it is. So I think that whatever I have attended, I have gained certain important knowledge as well as certain important concepts regarding.
Yes, Dr. Simon, very important topic. Yes, as you described, very, very important topic because the female doctor not only looking in the white coat and paying the duty, she has a lot of other things to do. Before I allow the people to question answer, Professor Majid Chaudhary Sahab. Professor Majid Chaudhary Sahab. Sir, unmute and then talk to Professor Majid Chaudhary Sahab. Okay. Okay.
Right. Can you hear me?
Yes, sir. Yes, sir. We are hearing, sir.
I think females are the most important human being in this world.
More than, sir. Yes, more than this, sir. Yes.
I think there is at every stage of life. You know, our prophet used to stand up always to greet his daughter. I I happen to have a lot of connection with female doctors as a principal of the first women medical college of Pakistan, Fatma Jinnah Medical College. And all the girls were scared of becoming surgeons. I encouraged them, and some of them are professors now in surgery. They thought it's very difficult. People used to discourage them. I think nobody has done more sacrifice for humanity other than females.
Other than the female, sir. Right, sir.
I think they ought to be respected at every level. I would always stand up in my office as a principal to greet a demonstrator, and will stand up and greet her. Even girl students. I think it was a nice talk. I think they do have a lot of problems. I'm working in cancer care hospital these days, and I see females with cancer breast in an absolutely appalling situation. And I think I gave a plan to the government to have breast clinics in all district and Tehsil headquarter hospitals. And I tell you, we are very, very wicked people. We don't treat females the way we should. If a woman has got an advanced breast cancer, the man has already found another woman. Honestly, we are a very, very cruel society, but I think all males must play our role to uplift this. And all these burnout problems are because they have multifaceted responsibilities at home, in the hospital, and sometimes there are cases of harassment as well. And I think all these issues have to be tackled very, very aptly. Thank you, and it's a very nice topic.
Thank you, sir.
Angelique has.
Thank you so much, sir. Thank you so much. We know, sir, Professor Ashraf Nizami, we all are witness, sir. All we are here, male or female, sitting before in this webinar or in any situation or any post, we are due to our mothers. Most of I think, will agree. If the females are not behind any person, I think success is very difficult. Nizami sir, what will you say?
Thank you very much, Bukhari sir. First of all, I would like to appreciate an excellent topic which has been chosen by my respectable Dr. Angelique, and particularly on the International Mother's Day. As far as Professor Majid Choisa was saying, I appreciate, and in solidarity with his statement. I think the issue is the discrimination, and if to be particular about the women discrimination, it does exist. Although in Lahore, there are the two institutions, the medical colleges are headed by women, rather 3 medical colleges are headed by women. And in the private sector, if we include, it is a change is there, although it is not that much what we have to see. And it is particularly about the underdeveloping countries, and the countries what we see, as far as I have the opportunity to see the society, the socialist society, that was the Soviet Union, and women were respected. And the main thing, that is the law, rule of law by the law. And indeed, the countries which have developed, they have developed giving the equal rights to the women. And very rightly been said that the organs and all that the almighty nature has made, that is equally the male and the female. And just I would like to appreciate, and me as a human rights activist, as the worker of the Pakistan Medical Association, we stand by, and well that Professor Salma Kundi, she had been the president of Pakistan Medical Association, Professor Yasmi Rashid, and a lot of number. And the renowned journal of the JPMA, Professor Fatima Jawad, she is a woman, and Alhamdulillah, that is the progress given and contributed by the women. And as I was talking about the first women in space, that was also from the Soviet Union. So women are at par with the men. And thank you very much, Anjali. And thank you, Mulazim Hussain Bukhari Sahab, for
Thank you so
choosing
much,
this
sir.
very important topic.
Today's
Thank you.
Mother Day. I'll pray for the mothers who are alive, and I pray for who are not here, including my mother is not here. I will request our people to pray for your mother. So now it is open for the question and answer. Any person want to ask the questions is uh, liberty to ask a question. Open the mic and ask the question.
While we're waiting, let me just say one thing. It
Can
comes to my
please?
mind.
Yes, Ji. Okay, Angelique.
So while I was listening to the professor from pediatrics, we always ask for breastfeeding and the campaign, but we should do that not only for the patients; it should be for our own colleagues
Yes.
as well. And what's hospitals bringing in that field? Would they allow a breastfeeding mother to come back earlier to work, and how do we handle that? Thanks. Back to you, Prof. Bukhari.
Okay, Dr. Salma, you are here. You have raised the question, Professor Salma. Ji, Professor Salma Kundi. Okay, her daughter Uswa
Sahab,
is
lots
there.
of prayers for Professor Salma for her
Assalamu
early
alaikum.
recovery.
Assalamu alaikum. It's a
Walaikum
very,
salam.
very slow recovery after the herniorrhaphy. I'm in so much of pain. I don't know what to do about it. It's bad. But I wanted to attend this because Angelique was so kind and she gave us the time. Angelique, I agree with whatever you've said. What would you suggest the changes that we can take and bring it up from the platform of PMA? I know the PMDC has done it. The PMDC has been kind enough to tell all the medical colleges to have creches and nurseries where there are places for breastfeeding. But what I want the PMDC to do further is those professions like anesthesiology and many others in which the girls and the ladies are on duty at night. And sometimes the environment is not safe for them. So shouldn't the PMDC work on this, that the women should have protection in our part of the world, which can be a very sorry and a very sad state of affairs. There were some incidents in our interior Sindh in which a young lady doctor was harmed. She was harassed by somebody.
Oh.
So, there are many things which should not be occurring, especially in the educated lot. And we should have policies and the government should work on it. And the medical colleges should have marks for that. That is the only way in which we can implement it and force it on the society. Thank you so much, Angela. It was lovely seeing you here. Thank
Madam
you, Dr. Mulazim Saab.
Thank you so much.
Madam
Ms. Ali
Salma,
Saab.
talk to me about your hernia pain.
Yes,
Ji.
Professor
I'll
Majid
ring you up. I'll ring you up.
Yeah, please do ring me up. Thank you so
I
much.
will. Okay.
Okay.
Allah Hafiz, Allah Hafiz.
Professor Rafiq Kanani Sahab.
Assalamu alaikum.
Walaikum assalam, sir.
Thank you very much for a very nice presentation and bringing forward the subject of a very, very important thing, that's the breastfeeding by the mothers as well. To me, we are, I think all over the country, we are not following the way we should be practicing our medicine. The most important part is the established protocols for every condition that we are dealing with. And pregnancy and delivery is the most important part of the life. We should have the protocols of not only the delivery, but breastfeeding after the delivery. That should be part of the protocol of antenatal as well as natal and postnatal workup of the clients. And these protocols should be written and available at every place, so that the breastfeeding, most of the time, I have noticed my wife is a breastfeeding practitioner, and even the best hospitals of the country are not really aware of what the breastfeeding is and how it can be materialized in cases which are difficult in finding the breastfeeding, or there are misconceptions and myths that should be removed. Thank you.
Thank you so much. Before I allow other people, Dr. Angelique, I will read one poetry, one sentence of Allama Iqbal, and then I will translate. And for others, it is in Urdu, and for you will be in English. वजूद जन से है तस्वीर कायनात में रंग इसी के साज से है जिंदगी का सोज़े दरूं. Our poet, our national poet Allama Iqbal says, the color of the universe canvas are from the existence of the woman, and from her inner instrument comes from the inner fire, that is the love of mother, and love for the husband, and love for the children. That is the inner fire, and the passion of life is due to this woman. So these are the greatest words by our Allama Iqbal. Any other person want to ask the questions? We have 10 minutes for question answer. Otherwise, we'll conclude. Somebody raised the hand, but Professor Lubna, you want to say something? Dr. Shahida Hussain is also there.
Sir, I had a question.
Yes,
What can
sure.
we
Sure.
what can we do on a personal level to raise awareness, and what protocols can we do to for our mothers?
Professor Lake, I at the end I asked you the summary. Can you repeat this?
If I can, for me, how can we make this change? Like I've just said to Salma here as well in the chat, what we have as females, we've got our voice. We have to be vocal. We have to stand together or being united. And Prof. Bukhari, you said it so nicely. We need to use our inner fire. If you can use our inner fire to ignite change, then change must follow. So we need to be there at the table where these policies are being drafted, and we need to make our voice heard there. For me, that's where that's where it starts. Stand united, use our voices, use our inner fire to ignite change. I hope that makes sense.
Thank you so much. Thank you so much. Kaisar Sajad is not here. He is, I think, in Nepal. No. Where I think Singapore or something else. Dr. Kaisar Sajad, would you like to say something, or we are now going to
He's in
conclude?
Australia, Bukhari sahab.
Yeah, yes, sir. He is in Austria, sir.
Australia.
Achha, Australia.
Yeah.
Yes, Australia.
Angelique, and they have the same weather over there. It is also cold in Australia. Yeah.
Okay. If there is no question or no suggestion, can we conclude today's session? Over to you, Professor Salma. Also, I will ask you to conclude today's session.
Sir, can I ask a question?
Okay, Professor Lubna, I gave you the opportunity to ask the question.
I just want to ask, is there any policy for the doctors for the health insurance and any medical treatment from where
In
they get?
Pakistan? In Pakistan?
Yes,
I
in
think
Pakistan.
no such policy is yet.
And in our other countries?
Yes, in
policy?
other countries, yes, and as I know,
if
in the USA there is a policy, but not in Professor Angelique, in your country.
Nope. So what is happening in our country? Most of the doctors belong to what we call PPS. It's a insurance company that if you get sick or ill health or whatever, then they will look after you, providing you must have at least 2 weeks being booked off sick. But There's nothing for maternity. If you go on maternity leave, in the private sector, there's no support. You would be out of money if you haven't provided and make sure that there are enough funds for you to survive. So this is discrimination again, especially, for our young female bearing children, colleagues, sorry.
Can I make a comment?
Yes.
Madam, anyone
Dr.
can
Lubna.
stand for against these things, because these are very important things for the female and male also. As a doctor, we feel very neglected in the area of health, because everyone gets
Ignore
superior
everything. Yes.
treatment, but we never get anything from the government, anything from anywhere. Even we are working in private or government hospital, no one consider our illnesses, our sickness, our pregnancy issues, and our parents issues, our family issues. No one address this thing. So any doctors unity group is available to do this statement, to work on it.
Can I
Lubna,
make a
can I
comment?
Ji, Professor Majid Chaudhary Sahab.
I think in this country, we don't have any such insurance policy unless privately hired by the institutions. But otherwise, I think in our country, all the big institutions where people are working, their women are taken care of. I mean, I used to be the principal, and I would go a yard outside my domain to help them out. In European countries, I think, like in Britain, they have a very good system, and so have they in Canada. In America, it's very expensive. In Canada, you have not only maternal leave, but you have paternal leave as well. And even in Britain and in some European countries, you have paternal leave as well.
Yes,
In
you're
this
right.
country, in our country, there is nothing which is done particularly at the government level. It's all with personal contacts or the institutional heads. They will facilitate their females to any extent.
Thank you so much, sir.
Bukhari sir, very important. Allow me, I would like to state that the Pakistan Medical Association, they loud about it for the women rights, and there which are in support to the women rights activists. And one thing what I would like to share to my colleague, that until and unless you speak for your rights, no one is coming to give you the rights. As far as I saw a very low number that what has happened in Karachi with the Shima Kirmani ji, who were talking about the women rights, and that is the society which is stopping all the women in Pakistan particularly, and if I say around the globe, this is the phenomena. But my message is, just you have to stand up for your rights, you have to loud and speak, and if there are the organizations,
and to raise the voice,
at least you have to.
Yes,
Exactly.
yes.
Thank you.
Yeah, thank you so much, Dr. Angelique. So many messages from your side. One of our biggest weapon are our voice, as Professor Ashraf told, and to stand united to make change happens. Our inner life. Thank you so much. And in South Africa, private sector, yes. I think that today's biggest message is that we should raise our voice and we stand together, inshallah. Well, inshallah, when these all questions answers what today's session, inshallah, we will write this in a news and a paper and in other areas, so that we can also raise the not only the voice, also but voice from these journals. Thank you so much, Professor Salma Kundi. Can you conclude today's session? Or because I just...
Okay. Thank you. Thank you so much, Mulazim Saab. And I'm so grateful to you, Angelique, coetzee. Love you for your time and hope to see you. I wanted to see you in May, but maybe I can't make it to Lahore this time. Have a very great time with Ashraf Nizam Saab and our PMA team then. And thank you to all the attendees. I only want to make a statement that in my province, KPK, we have the Insaf card. and whether men or women or children, they're all covered by it. So they get the health coverage, and it is being done by the government of Khyber Pakhtunkhwa. And I think all the governments should do it. They should look after their people. The other thing is that the PMDC and the government does have a 33 months maternity leave. And now the paternity leave of 2 weeks has also started. So we should avail it, and it should be brought into our network. And then every medical teaching hospital has a 20% waiver for their employees. And if it's not there, it should be complained against that, and it should be brought to the notice of the higher-ups. That's the little that I can say now. Have a great weekend. Have a great time. Allah Hafiz, Pakistan Zindabad. Allah Hafiz.